This presentation is about clinical eye openers, in short CEO. The central aim of this effort is to rely on provocative images as a source of signs. It requires that we be able to see them, to have our eyes open. For instance, in this little infant's face, we could say that I see one sign, epicanthic folds. Do you see anything else? Do I? And if that's the only sign, do we know what the sign is a signal of? Signs are objective signals. It's a matter of opinion, is how prepared are you to interpret them. Is this enough to say that this baby has Down syndrome? You may say so, but the mother wouldn't believe you. It is cute, it is not malformed, it is sleeping peacefully, and every structure of the face is not malformed. So what about epicanthic folds? Why is that enough to give such a dire prognosis? So indeed, clinical eye openers try to bridge the increasing problem for clinicians to have the eye opens, because during their education so much time is absorbed by basic sciences and scientific advances. So our credo then, our belief is indeed that we should emphasize images, whether they are clinical or they come from the fine arts, and as much as possible clinical videos. Now, to aid this mission, we rely also on practicums or tutorials, so to facilitate the skills on memorization. We must be entertaining or else we're going to fail. And we must reinforce of what you already may know with image galleries. Notice on the left that we're going to be showing a series of images of infants with Down syndrome, all alike and yet all different. What do you see? What don't you see? And from that we often draw clinical tips and pearls. Now we need to communicate, so concurrently we emphasize English medical terminology. This is the lingua franca. And since this field is rapidly evolving, then so is the terminology, and at times it is very, very, very confusing and ill-defined. Notice the baby on the left. What do you see? What signals do you see there? Signs, of course there are some, but are you sure the signal is Down syndrome? Now, this ability to recognize signs is directly connected with the advances of clinical genetics, clinical teratology, and clinical epidemiology, so that the footing of dysmorphology, that is, the study of abnormal formations, stands on very firm basic sciences that are rapidly expanding and connecting the clinic with the understanding of pathogenesis, etiology, and those become synthesized in what we call diagnosis. So, who is this for? Well, it's for individuals of any age, because I and many others with me believe that the study of medicine is lifelong. So we all are students of medicine, whether we are medical students, interns, residents, Instructors, professors, educators, it doesn't matter. We all can learn. Now, a subset of clinical eye openers is an important facilitator. It is a practicum or a tutorial on dysmorphology, which defined briefly is the study of altered formations. Altered formations result not only in structural but also in functional anomalies. The prevailing English medical terminology favors birth defects. It is scratched because that's an unsatisfactory notion. Not all of them are congenital and not all of them are defects. And so we need a nomenclature. Malformations, deformations, they can be structural, functional, congenital, postnatal. All of this needs to be presented concurrently. And this practicum then becomes the vertebral spine of the effort, 20 modules with 29 embedded clinical videos, and we highly recommend it before you go on into viewing galleries of mysterious patients. Along the way then, a synthesis is in order to formulate hypotheses of pathogenesis, etiology, and diagnosis. So this is a little window toward the website Clinical Eye Openers. The channels of current menus are divided into signs, syndromes, patients, or medical arts, and then synthetic themes and overviews, clinical tips and pearls. For instance, what does it mean to have melanic spots on the skin? What do you do with it? How do you approach it? How do you move forward? And all of that can be supplemented by eminent presentations and lectures. Concurrently then, the emphasis, as I mentioned, is on English medical terminology, illuminations of terms. For instance, illuminated on the right is the notion of female, and the question is, what has that to do with femur? And then the word roots, those are important notions because they will help you fully understand the very broad implications of medical terminology and how to remember it, because the word roots are memorization aids. And who does this work? Many of us. All virtually are MDs proficient in one or another aspect of this morphology, with the aid of technical editors. Sometimes these names expand or shrink according to possibilities and responsibilities, so contact us if you need to talk to some of our colleagues. To close then, clinical eye openers are various galleries of images. If you want to know about me, the speaker here is on the left, and then on the right you have images of templates of pages underscoring what and how they look, and you're welcome to go to the website itself, where I hope to see you there. And until then, my best wishes.